Hi everyone, Patricia Worby Alchemy Therapies here, and I wanted to talk this morning a little bit about the new landscape we find ourselves in. I'd like to say post-COVID, but we're clearly not there yet. And although we're making inroads now into understanding what the disease is and how it works in the body, I think politically we're in a complete stasis because we don't really know how to balance the books in terms of how do we keep people healthy and at the same time keep our economies, going. So, but there have been some, positives coming out of this situation, and I wanted particularly to talk about that today. In the UK here, although we have one of the worst records in terms of deaths per population and also economically, we look like we're going into free fall. There have been some remarkable things happening, I think, in terms of the understanding of how health and social care should interact, and indeed what health actually means for a population. And that's what I want to talk about today. So a couple of weeks ago, our Health Secretary, Matt Hancock, made a very long speech, some of which was criticised because he started out with a description of the fire of London and how COVID was a sort of equivalent moment in history. I don't want to talk about that bit particularly. I think it was perhaps a little ill-chosen. But I did pick out some bits from his speech, which I wanted to comment on. So I'm going to do that here. So, okay. The first thing perhaps to note is he said, the future of health and social care will be built by those striving to keep the population healthy, not just to fix the ones who are ill. Now, that is a radical statement. It's something that naturopaths or people who understand natural medicine have been doing for years. And it predates, in fact, it predates conventional medicine by, many hundreds of years, because people who use natural medicine actually look at the body as a self-healing mechanism. And in order to help people heal from disease or illness, you have to remove the blocks to healing. So rather than fix the symptoms, which is what conventional medicine does, it just blocks the symptom or reduces the symptom and doesn't look at the root cause. It treats everybody the same, in fact. So if you go to your doctor and you have symptoms of diabetes, you will be treated with exactly the same drugs, pretty much, with no accounting of gender or age or what's happening in your life. In fact, you're very unlikely to even be asked what's happening in your life. Where do you lack sweetness in your life? How was your upbringing? What needs didn't get met? Because these are very strong correlations, in fact, with what diseases you get as you get older, and your coping strategies and your repair mechanisms start to falter. And that's indeed what happened to me. And I've talked about that many times when I hit 34. So I'm a long way from that, by the way. But anyway, I think I'm healthier than I was then. And, I'm actually striving now to apply what I learned from my situation to help other people going through something similar. So keeping well is not about, just taking the drugs, taking the pill for every ill. It's about actually looking at all the drivers in your life, the biopsychosocial drivers. So, what's your biology? What sort of things have you inherited? Psychologically, what kind of thoughts do you think? What friends do you have? What relationships surround you? Are they dysfunctional? And socially, how do you interact in the world? What sort of work do you do? How do you have good meaning and purpose in your life? So these are all really, really important things that need to be brought together in a model of health. So I totally agree with him on that one. He carried on to say, and as we do this, in other words, try and look at keeping the population healthy, we need to look beyond healthcare at everything that makes us healthier and happier. Again, totally agree with that. We need to be looking at the sort of things that people do outside of work. Do you have hobbies? Do you play? Do you have creativity in your life? Do you have meaningful relationships that make you feel good? Do you contribute to the world? Do you help keep this world a happier and healthier place? Or do you keep it, beautiful? Because this world is beautiful, even though it's going down the pan right now. Mainly, I think, because of the lack of political will and disconnected people in leadership positions, and a lack of the feminine as well. We're very masculine driven, very about competition and dominance, and not about cooperation and trusting each other. So, are those things present in your life? And if they're not, what can we do, not only as individuals, but what can we do as a nation, or more than that, as a world, to promote those kinds of understandings of, meaning, purpose, justice, to make us healthier. And as we make ourselves healthier, we bring in the love of the earth that sustains us, because at the moment we're just spreading our junk around and making the world very dirty. And that's partly why coronavirus has come to kind of tidy us up in a way. Viruses only really take over where there is a lot of toxins, a lot of junk in the environment, in the bodies of the people that it infects. So, there's a lot you can do just yourself in keeping yourself healthy. So we need a much broader canvas, in other words. And he said, and this is particularly relevant to the UK, perhaps not so much to the rest of the world, but that the nation's health is so much bigger than just the NHS. And that's the National Health Service, which, for anybody watching outside the UK, is an insurance-based system, but it's a national insurance system. Everybody is required to pay it. It is not something you choose to do. You pay from your income, and everybody agrees to do that. And we did that because after the Second World War, the UK was in a terrible state, and it was part of the sort of post-war deal, really, to improve the health of the nation and to move us forward. Now, the NHS has been, really, really celebrated during this period, because it really stepped up, and the people that worked in the NHS, because it is a national health service, they feel they have some kind of input. They feel like they're doing something worthwhile. There are problems with the NHS structure. It is massive. It's unwieldy. It has a lot of regional variation, depending on, the different management styles. But overall, it's a really incredible, and we should be so proud that we set this up and that it does run. But we need to look beyond it now. We need to find ways that support people in communities, in their home, in where they live, and not just when you get acutely ill and have to go into hospital or to your GP. So yeah, we've, as naturopaths and people who are involved in therapy, as I am, helping other people, we do know this. We when we're working with people, we know we've got to work with a whole person and not just the condition or the symptoms that they're showing when they come and see us. So I was celebrating because, I haven't heard a government minister say anything quite this radical in a long time. And for those of us working in therapy, particularly the work that I do with chronic illness as a chrysalis effect practitioner, I work with people with CFS, chronic fatigue syndrome, sometimes also known as ME, fibromyalgia, and other long-term conditions for which modern medicine really doesn't have an answer because of the siloed nature of the specialty system, where you just get moved around from different specialties and you don't ever get a joined up approach. So yes, great. However, further down in the document, there were some bits that disappointed me somewhat. And this isn't a verbatim quote, but basically he was saying that we need a vaccine before we can return to normal life, right? And that's the approach that this government seems to be following, and governments all around the world, led, it has to be said, by a pharmaceutical lobby that is vastly, resourced. They have $1 trillion to spend on, promotion and lobbying, and they've infiltrated a lot of the teaching as well of doctors. So what is considered conventional medicine is basically pharmaceutical medicine and surgery. And so, the idea of a vaccine being needed, necessary, is why we are still in the fear pandemic, which I talked about right at the beginning of this. You need fear to sell a solution. And the solution at the moment seems to be, not only a vaccine, but a vaccine every 2 years. This came out last week as well. a member of the SAGE committee, which is the advisory body for the UK government, said that we'll never beat coronavirus and we're going to need to all be vaccinated, so mass vaccination every 2 years. You know, this is coming out of the scientific consensus. But the problem is we have a government that don't have a scientific training, unlike me, I do. And so they just believe that there is this thing called science, that there is this agreement amongst scientists about the right way and what's correct, as if truth were one thing, not realizing that truth has been really largely circumvented here by very powerful vested interests. And also there is no consensus. And if you look at the alternative SAGE committee, there is one, of other scientists who are saying, hang on a minute, this solution is not built on the real science, which tells us that the vast majority of people get COVID-19 without producing antibodies because they're asymptomatic and their immune systems are well able to cope. So I'm not minimizing the deaths, I never have. I've always been very sympathetic to the vulnerable in our society who we should have protected much more and earlier as well, you know, the elderly, the immunocompromised and so on. But for the vast majority of people, the science is showing that you don't get antibodies produced because you fight it off at your innate immunity level. In other words, via your gut immunity, which is 80% of your immunity. I've done a talk about this. I'll post the link below. So having a vaccine for antibodies is unnecessary. It's also going to give people symptoms. It's going to probably make them more vulnerable to future coronaviruses and flu viruses in the future. That has happened with the flu vaccine. It's given to elderly people whose immune systems are already compromised. And because of the adjuvants added, you know, these toxic chemicals that are meant to provoke the immune system, but can actually make people very ill. We are basically licensing the idea that our immune systems are not competent, and we're not looking at how we can boost our immune systems to actually fight off viruses like this in the future. We're also not looking at how our food is produced and how that has actually, you know, raising animals in filth, their own excrement, and having people in food processing plants who work really close together. And I mean, this is not natural. This is not the way human beings are designed to live, and we are reaping the benefits of that or not. So I totally disagree that we need a vaccine. I think what we need is a healthcare policy that looks after the health of the nation in a much, much broader way. And in order to do that, I want to propose an interdisciplinary, I guess, integrative medicine as the way forward, using all the best of holistic medicine and the best of, you know, conventional technological medicine, and bring that together, but without this bias that we now have in our healthcare from the profit motive of selling drugs and vaccines that simply reduce symptoms and don't deal with the root cause, which, as I've said, can be, you know, multifactorial. So anyway, I've said my piece. I just thought I wanted to say that to you today, and keep well, obviously keep safe, but don't live in fear. Build your own immunity, do what you can, and love life. It's here to support us. Thank you for listening.